Hello? Hello everyone. So finally this long awaited day is over and you can have a good dinner at peace. All the hard work you have been putting in, finally it comes to an end. It was a good paper, as I can tell you about Obs and Gynae. The questions were very interesting, but good thing was all of them were from the repeated topics and some were direct repeat. No doubt questions seemed easy on seeing the question itself, but as soon as I jumped to the options, they seemed little tricky. But just a little thought and you will get the answer. So it was a very good paper. Without wasting any more time, let's start with it. Let me take a from the repeated topics. Okay. And somewhat just hold on, I should mute myself. Okay. So the first question was, what is the most common cause of cancer in women? So the cancer Indian cancer census was released in 2020. So in 2020 they released their census and they studied 28 states and they released the data about what are the common cancers. They said in females the most common cancer is breast cancer. Not only in India, overall. So they gave a result that overall everywhere the most common cancer in females is breast cancer. Second most common cancer they said in India is cancer cervix. Cancer cervix is not common in developed countries. It's a cancer of a developing country. So second most common was cancer cervix. After that they said it was throat cancer and it was stomach cancer. So to my surprise also lung cancer was not in the top 4 list. So most common is breast cancer. Correct? Okay. MTP for contraception failure. See, FMG people love MTP. Last time they asked 3 questions from CAC guidelines. This time they asked, I think 2. So according to MTP, they have asked it multiple times. If the indication is contraception failure, you are allowed only till 20 weeks. If the indication is some maternal or the fetal problem is there, if that is the indication, then the gestation is 24 weeks. So for contraception failure, without doubt, there is no debate about it. It is 20 weeks. After that, you are not allowed for MTP if the reason is contraception failure. Right? Okay. Postpartum copper-T can be inserted up till. So postpartum copper-T, see, after a woman has delivered, you have 3 chances when you can insert a copper-T. One is immediately after delivery. That we called post-placental. As soon as placenta is out, you insert the copper-T. That is one. Another one is within 48 hours, yani within 2 days. After 2 days, what happens? The involution starts and uterus becomes very soft. So the chances of perforation and expulsion are very high. So after 48 hours, you don't insert. Then you have to insert after 6 weeks. So within 48 hours, you have to insert a postpartum IUCD. Right? Chalo, next. A 35-year-old woman, this was a very direct question. They were throwing answer on your face. Irregular menstrual cycle, hirsutism and acne. So we understood some hyperandrogenic condition is there. Let's understand what it is. They said she has acanthosis nigricans. Means it has insulin resistance. Yes, and they have also given it. They have insulin resistance, serum testosterone is high. So they have given everything and a very beautiful picture. So what it is? The peripheral, can you see peripherally arranged small cyst? It is polycystic ovary. Right? Yes. Now a pregnant woman at 10 weeks comes with vaginal bleeding. So we read that vaginal bleeding at 10 weeks. Now we have started thinking abortion, ectopic, molar. Kuch bhi ho sakta hai. Let's go ahead. They gave us ultrasound of snowstorm appearance. As soon as we get this appearance of snowstorm, we know we are talking about molar pregnancy. And also they said beta CG is very high. So it is molar. That is clear. But they are not asking diagnosis. They are asking management. As soon as you read molar, do not come and jump onto methotrexate. Methotrexate, I have insisted many times, is not the treatment for molar. Methotrexate is treatment for ectopic and choriocarcinoma. What is the treatment for molar pregnancy? Take it out, suck it out, dilatation and curettage. That is the treatment for molar pregnancy, not methotrexate. Okay? Repeat ultrasound? No. Diagnosis is confirmed. Why will you repeat? You will just curate it out. Immediate termination of pregnancy? Yes, you are terminating, but it is not a pregnancy as such. So this is not a right kind of description of the management. So it is not wrong. You are terminating, but this is not how you will describe it. You will describe that management as dilatation and curettage. Okay. HPV responsible for cancer cervix. I don't know what the options were, but these are the HPV which are responsible for cancer cervix. Besides that, there are many other 35, 39, 45, 51, 52. But as far as I feel, these are the most common. So these might have been there in the option. 16, 18, 31, 33. ये तो सबको याद होना चाहिए. This is something which everyone should remember. Okay. Let me see some questions which you are putting. Yes, Dr. Chaudhary, I have written down. So postpartum copper T can be inserted within 48 hours beta. After that, wait for 6 weeks. And once after 6 weeks, you will not call it postpartum. You will call it interval IUCD then. Right? A 28-year-old pregnant woman comes at 32 weeks. Okay? With sudden onset of severe abdominal pain and bleeding. So she is 32. She has come with abdominal pain, severe pain. It is not labor pain. They are clearly indicating severe abdominal pain. Some pathology is there with bleeding. It is not show. They are clearly writing bleeding. So when they are writing you, giving you something, take it in that form only. It is pain with bleeding. Uterus is tender and firm. So at 32, it is antepartum hemorrhage. What reasons we read of antepartum hemorrhage? Remember in class, what do we read? Either it can be placenta previa, or we read ki it can be abruption, or it can be vasa previa. But we read placenta previa has relaxed uterus. When is uterus contracted? Abruption. Uterine rupture? No. Uterine rupture has been asked many times in FMGE exam. And they give always the same scenario. They give that fetal parts were palpable per abdomen. Why were they palpable per abdomen? Because fetus was in the abdomen, uterus got ruptured, fetus came in the abdomen. So that is how uterine rupture present. Fetal parts palpable per abdomen. It is uterus is tense and tender. It is not ruptured. It is abruption. Okay. 17-week pregnant lady comes with BP 140/80 and no proteinuria. What is the diagnosis? So this is very basic. Sometimes we go on reading everything about eclampsia, pre-eclampsia. We do not know the exact basic. She is 17 weeks. So what is she? Is she gestational hypertension or pre-eclampsia? Gestational hypertension and pre-eclampsia have to happen after 20 weeks. They are because of placental invasion. Placental invasion happens at around 20 weeks, at around 15-20 weeks. So it will start only after 20 weeks. If something is happening before 20 weeks, it is not gestational, it is not related to pregnancy. It is because you are already hypertensive. You didn't knew about it. So at less than 20 weeks, it is chronic hypertension, right? Is it non-hypertensive? No, she is hypertensive. Systolic 140 or diastolic 90. It is or. Any of these can be raised. Both of these do not need to be raised. So one is raised, it is hypertension, chronic hypertension. Okay? A lady with previous neural tube defect. When to start folic acid? A lady who has high is a risk factor for a neural tube defect. Again, you will start at least 3 months prior. And what will be the dose? Therapeutic dose. That was the question asked last year. So therapeutic dose start 3 months before and continue till how long? 12 weeks. Not till whole pregnancy, only till 12 weeks. 12 weeks the neural tube has formed. So till 12 weeks only. What procedure? So there was a scenario where there was a nulliparous woman, or some students are saying it was early pregnancy. It doesn't matter, management will be same. With prolapse, if it is nulliparous, she will eventually plan pregnancy and will try to deliver. If you will do any procedure like Fothergill or sling, it will fail. So in nulliparous patient and in pregnant patient, your first option is always pessary. Unless pessary fail, then you have no other option, you go for surgery. But first option is always pessary. Okay? Ideal antenatal visit. So very confusing question. Ideal, they are not asking minimum. At least कितना होना चाहिए. What is ideal? What will you tell your patient कि ideally आपको कितनी बार आना चाहिए? Will you tell 4? 4 तो minimum है. इतना तो you have to come. So according to Indian guidelines, 4 visits are minimum. According to WHO, 8 visits are minimum. Ideal is around 12 to 14. ये ideal है. What does our government say? Our government say कि भी less than 28 weeks पे you have to come monthly. So that is 7 visits. Then they say 28 to 36 पे come twice weekly, every 15 days. ठीक है? So here come 4 visits. ये 4 हो गए. And after 36 weeks come weekly till you get delivered. So that's come out to be 12 to 14 weeks. 12 to 14 visits. That's ideal. Okay? Contraindication of Ventouse. So see, there are some specific contraindications for ventouse which are not there for forceps. What are they? Decrease bear down effect. Decreasing bear down effect is an indication for ventouse. This is a condition where you apply ventouse. In heart disease, you apply ventouse to cut short the second stage of labor. In preterm, you apply ventouse? No, because there is risk of what? There is risk of scalp avulsion. It's preterm scalp. In preterm, ventouse is contraindicated. This is your answer. Dilatation more than 8, it's a good sign. It might be 10. So here you will apply ventouse. Besides preterm, what are there other contraindications which are specific to ventouse? Phase presentation and coagulopathy. In these conditions, you always prefer forceps, not ventouse. Exclusive breastfeeding, I know you all know this. This is 6 months. Exclusive. No water, no food, only breastfeed for 6 months. Bartholin duct position, it is posterior 1/3. So in your vulva, either somewhere is clitoris, then is urethra, then is vaginal outlet. Is posterior 1/3 is Bartholin gland. What is anterior 1/3? Skene's gland, paraurethral gland. Skene gland is anterior, posterior is Bartholin gland. Okay. A 28-year-old had abnormal bleeding. With spotting, she comes since 1.5 months. So this is a clear-cut case of abnormal uterine bleeding. What will be your investigation? So what are the common causes of AUB in 28-year-old? We know anovulation हो सकता है ma'am. Then infection हो सकता है. But the most common cause is pregnancy related. You do not start any investigation unless you are sure that she is not pregnant. So you will do everything. You will do pap smear, you will check her for ovulation, but the first thing is rule out whether she is pregnant or not. So this is your first test, pregnancy test. Ectopic pregnancy marker. In ectopic, when you have read nothing else but beta-HCG. Beta-HCG is marker for diagnosis of ectopic. Beta-HCG is marker for prognosis. If beta-HCG is high, we will go for surgery. Not high, we will go for medical management. And for follow-up, whether our medical management has completely removed the ectopic or not, how will we know? We can't see it on ultrasound clearly, right? So follow-up also beta-HCG. So beta-HCG is everything for ectopic. Okay. Post-coitus best contraceptive. So what are they trying to act? Means coital act has happened but without protection at that time. So post-coitus means they are asking for emergency contraception. We have read only 4 emergency contraception are allowed by WHO. What? One is given LNJ. Besides that, ulipristal, copper IUCD and Zuspi's method. Lot of OCPs. Plain estrogen is nowhere written, right? So LNJ 1.5 mg within 72 hours is the post-coital contraception. I hope that was the question, right? If any question is going incorrect, then please let me know. During delivery of head, shoulder got stuck. What it was? Was it CPD? Cephalopelvic disproportion. Cephalo means head. It was not disproportion of head. Head came out. Shoulder got stuck. So problem is at shoulder. What problem? Shoulder distortion. Right? Okay. So what was this question, if somebody can tell me? Breech at 40 weeks in labor. It means you are trying to deliver this breech vaginally. So what are the prerequisites? What all you want? So somebody told me that this was the option. If emergency LSCS facility was option, yes, you want this. Besides that, what are other prerequisites? First, baby should be of normal weight. Means nahi heavy, nahi weak. It should not be small size, it should not be big size. Head should not be extended. Head extended nahi hona chahiye. Then it should not be footling. And what about your setup? What do you need in your setup? In your setup, there should be facility for LSCS. In your setup, there should be an anesthetist available there. There should be a pediatrician available then and there. That is what is needed from the setup. So this is the prerequisite. Then only you go for vaginal breech delivery. Clear? What was the question about Lippes glue? Please somebody tell me. What I can tell you about it is first generation IUCD. It is inert. It has no hormone. It has no copper IUCD. So this is Lippes glue. If that's what they asked, then I hope all of you knew it. Now you tell me. Now I got to know there were few questions but I'm not very sure whether they were there or not. A 75-year-old lady with prolapse, advanced prolapse, was it there? If it was there and these were the options, 75-year-old lady with advanced prolapse, you can see that either grade 3 or 4, not less than that, isn't it? What will you do? Pessary placement, pelvic floor exercise and observation will not help in such an advanced prolapse. What will help? Only hysterectomy. We don't want to save the uterus. She is 75 years old. So that will be the answer. Okay? If there was a question on cancer cervix, I'm not very sure. Some people told me. There was a question on cancer cervix 3B. If it was there, obviously chemoradiation. Anything beyond 2A is chemoradiation. Right? So this was all about the questions. I hope you all did well. If there is any confusion, let me know in the comments, and very good luck for the results. Bye bye.